I'm Dr. Saunders. This is an educational video on scars and incisions. Incisions are what we use to perform cosmetic surgery and all operations, and they turn into the scars. And so this video is done to give interesting information that can help patients understand about their scars and how they heal and unique features about them. The most important thing I want to cover is scars on the face. The face is very privileged and leads to the best scars. There's a real estate motto called location, location, location. And just like the real estate motto, scars on the body heal the best on the face. The face is without doubt the best place for incisions, which turn into the scars, to heal. And that's because the face has unique blood supply, there's muscles of facial animation, and the particular quality of the skin leads to a fantastic scar. Patients will sometimes be worried about doing eye tuck surgery called a blepharoplasty, or be worried about a facelift because they're like, oh doctor, I don't want to have scars on my face. And it's very understandable, but the truth is the face is the most unique place. It's why we can do these operations, because they lead to such good scars that are difficult to see. And it's a very important feature of understanding how scars fade. A unique thing about the cosmetic procedures is they're hidden into the nooks and crannies to even make it look even better. So facelifts are done with incisions around the ears, and eye tucks are done with incisions around the eyes. To prove this point, I can show you a scar that I have. I had skin cancer. I have a 4-inch scar right here on my cheek. Now, I know in this video it's hard to see it because we're not zoomed in, but the incision is right out in the open because I didn't get to choose where that skin cancer is. Fortunately, it was not a melanoma or a bad one, so the cure was to remove it, but I'm left with a scar that has faded with time, and I'm very happy with it. But imagine if that scar was hidden in the nooks and crannies, as I've mentioned, then it would demonstrate how great these incisions are for performing these cosmetic procedures. And that's because, once again, the face is so unique in terms of its healing and gives us the best scars. Like real estate, location, 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 the face is a wonderful place to heal. Now, other parts of the body also can heal well. Let's talk about a tummy tuck. Tummy tucks are operations done to define the abdominal area, to sculpture the area, to tighten the muscles. And they're done with incisions down above the pubic hair. And I sew up all my incisions with inside Pretty Little plastic surgery stitches. And this gives us the best chance for the scar to fail. But it's not going to heal as well as a face for the reasons I described above. But it's hidden in the underwear line and bathing suits, and so it gives us the benefit of the tummy tuck by an incision that's in a great location to be hidden. Now, if a patient comes in and she is interested in performing a tummy tuck and, let's say, a thigh lift, well, the tummy tuck, as I mentioned, is a curvy linear incision down above the pubic hair, hidden down low, but the thigh lift is performed with what's called a stocking seam incision along the thighs. And that's not as hidden as well as the tummy tuck. So often I will say, well, let's just do the tummy tuck first, and I'll sew it up with the small stitches, and we'll get a good idea of how your scar will fade. And then if we like the way it fades, and most people do, because the majority of scars heal nicely, then they can be more inclined to proceed with the thigh lift at a later date, because they have a good idea of how their body heals. Now, with all my operations, I include 3 free laser treatments. The lasers have been shown to help scars fade. The procedures usually or the laser procedure usually starts 4 to 6 weeks after the surgery, and then the 3 treatments are spaced 4 to 6 weeks apart, and I've believe, and in my experience, that this really helps our scars to heal and fade. Another aspect of scars that I like and find something that is rewarding in my career is some people don't end up with scars that they like. And as I said, most people, the scars fade well, but not everybody has cosmetic surgery, and some people have trauma or lacerations, and some people will have scars they don't like. And this is something that I offer for them, and it's called a revision or a scar redo. One common one is a puckered C-section scar. Now, what happens with C-sections is the doctor cuts through the skin, cuts through the fat, cuts through the muscle, and cuts through the uterus all in the same plane. And then when he or she sews it up, the scar tends to get puckered, very commonly actually. And then they get a little ledge and they're unhappy. And that's something that I like to help the patients with. It's called a scar revision, or once again, a redo. And what I'll do is I'll take out that scar with some surrounding skin, so it's kind of like a little extra mini tummy tuck, and sew it up pretty plastic surgery manner in a different plane from the muscle, so the odds of it repuckering are extremely low and has a high success rate. It makes people very happy. Some people, that if they have poor scars from skin cancers or other injuries or lacerations and it hasn't healed well, it's something I can help them with. It's something that I like. As I've mentioned, the face heals so well, but not everybody. And in that case, I can work with them to do a scar revision to help the scar be much more attractive and flatter. You can never completely get rid of a scar. Once you have the incision, scars fade with time, but they never go away completely. And this is a perfect time to segue into how scars heal. They fade over a year, sometimes longer. I have scars that from hernia surgery that have taken more than 2 years to completely fade. So I sew up the incisions with inside pretty little plastic surgery stitches, and then typically scars get red. And that's normal, and they get slightly elevated and hard, and that's called the healing ridge. And over time, that scar will flatten and improve. One last topic that I want to include in this educational video is something that I find fascinating, and it's on scar healing, and that's called scar maturation. As I've mentioned, it can take time for scars to heal, a year, sometimes longer. So what happens when we have a scar, the body will make collagen and then break down the collagen, make the collagen break down. So it's a cycle. And the making of the collagen, which is the main building block of the scar with some other ingredients like hyaluronic acid, is disorganized initially. And over a year and even longer, the scar collagen gets remodeled and organized during this process. And the process goes on forever. So if you're in a plastic surgery educational course in residency, they'll say, how long do scars heal? And someone might say 1 year. No, the answer is forever. And that's because even though after a year or two, for all intents and purposes, the scars look like they're completely healed, it's still going on. So the vitamin C is the key ingredient, or the key vitamin for one of the enzymes in the collagen formation. So where this becomes fascinating is in the 15 and 1600s, when our sailors or the English sailors were sailing the 7 seas, and they got vitamin C deficiency, which is the key ingredient in the collagen formation, they would get a disease called scurvy. And with this disease, the scars that they had would continue this process. So they might have a scar on their forearm that was 15 years old, and they didn't have vitamin C or citrus fruits on the boats. And then their scars would continue to break down as they've been doing, and without the new formation of the collagen. So the vitamin C is in the formation of the new collagen, the breakdown would continue. So their old scars that were 15 years old would break open. And this would show that scars are continuously healing forever, although for all intents and purposes, you see this just for the first year as it fades to a normal color. And so back in the 15th, 16th century, people sailing the seven seas, they didn't know the cause of scurvy being a vitamin C deficiency, but they knew that citrus fruits would diminish this problem, and hence the English sailors were called limeys because they would eat limes to help diminish this problem. So it's a little clinical story that's related to the history of sailing and the seven seas. I find it fascinating. So I hope you have found this video informative and educational. I included a little story at the end just for fun because I find it interesting. I specialize in cosmetic surgery and do exclusively cosmetic surgery. If I can help you with any concerns related to your scar or incisions or anything that I can help you with, please don't hesitate to call the office and schedule a consultation. I'd be happy to see you. Thank you.